Good morning, good afternoon, and good evening. It's very late for some of our panelists here. I'm wishing you all a very warm welcome and thank you for joining this web event to mark the launch of a new UNICEF report, the role of remote modalities in implementing mental health and psychosocial support programs and services in the education sector. My name is Rachel Smith and I am the coordinator for psychosocial support and social and emotional learning here at INEE. I'm delighted that we're able to host such a fantastic panel for you today. First, we'll just take a quick look at the agenda. If we can go to the next slide, please, Ola. Great, so in a moment, we're going to hear from Bassem Nasir at UNICEF for some opening remarks before we hear a presentation of the study findings and the recommendations from Anna Dabrowski at ACER. Then we will get an opportunity to look at some MHPSS programming in action from the Sesame Workshop and from UNICEF's Office of Global Innovation. As ever with our events, we will round off with a Q&A session. So you're invited to submit your questions in the Q&A function throughout the web event. Maybe some of our panelists will get around to answering those live, otherwise we will reserve them for the Q&A session at the end. Next slide, please. So I am delighted to hand over now to our first presenter. Bassem Nasir is an education specialist at the UNICEF headquarters team in New York and is responsible for driving the work on secondary education, skills, and MHPSS in the education team, supporting regional and country offices in implementing their work and leading global partnerships with public and private sector stakeholders. So over to you now, Bassem. And I think you can stop sharing screen, Ola.
Thank you so much, Rachel. Can everyone hear me? Just want to make sure. Great. It's a pleasure to be with you today on this webinar, a really opportune time right after the Transforming Education Summit, where UNICEF, along with the WHO, UNESCO, and the governments of Spain and Thailand, organized a high-level meeting on promoting and protecting learners' mental health and psychosocial well-being in schools and learning environments. I'm sorry if you can hear there's a sound at my door. At the Transforming Education Summit, world leaders and many other partners have just endorsed the commitment to action on foundational learning and a pledge to invest in the mental health and well-being of every learner. This came with the realization that even before the pandemic, mental health conditions in children and adolescents were on the rise. UNICEF estimates that 1 in every 7 children between 10 and 19 years old was living with a diagnosed mental health condition. The pandemic has made it worse. Virtually every country in the world has seen the problem grow. Children growing up in the midst of conflict and other crises face even greater challenges to their mental health and well-being, to say nothing of their education. So with such renewed focus on this agenda and commitment to providing MHPSS as a core component in education and learning across the life course from early childhood to adolescence, the launch of this report is timely to shed light on how we can expand our toolbox of providing MHPSS to children and adolescents through remote learning modalities, which are becoming a normal in education landscapes, but also need a lot of work and improvement in terms of safety, effectiveness, and evidence as we prepare ourselves for future shocks to the education system. I want to thank our partners and reference group members who helped us produce this report, Asim Latif from INEE, Gerhard Pulfer from Porticus, Graciela Briceño from USAID, Hervé Morin from UNICEF, Maria Fernanda Porras from UNICEF, Sally Gear from FCDO, Sarah Yesan from UNICEF, and Zainab Shazi from UNICEF. Hope you find the webinar helpful, and we look forward to engaging you further on this exciting agenda. Back to you, Rachel.
Thank you so much, Bassem. Now I'm handing over to one of the authors of the report, Dr. Anna Dabrowski. Dr. Dabrowski is a Senior Research Fellow in the Education and Development Department at the Australian Council for Educational Research, ACER. Anna's research focuses on system resilience, encapsulating teacher education, student and teacher mental health, inclusion and gender equity. Anna holds qualifications in the areas of education, linguistics, and psychology. Over to you, Anna.
Thank you so much, Rachel. Hopefully everyone can see and hear me. Thank you to INEE for hosting the event, and to UNICEF for providing us a platform to share our research findings. Just as I begin, Bassem already touched on our reference group who were involved in the report. My colleagues and co-authors, Kashfi Ahmed and Catherine Dix, are also with us today. And Bassem Nasir and Patricia Leondinez have also overseen this report. So today we're going to talk a little bit about the role of remote modalities in supporting mental health and psychosocial wellbeing in the education sector. So let's begin. So in terms of mental health and why it's important, defining mental health can sometimes be a little bit complex. Often when we think of mental health, we think of mental health conditions and we think of mental illness. But indeed, positive mental health is really a state of emotional, psychological, and social well-being. And it's really important because it helps us not only to build resilience, but to participate fully in society. Mental health is particularly important for children also, and positive mental health in particular is a protective factor. Most mental health conditions onset around adolescence, with around 50% onsetting before the age of 14. Now, as Bassem pointed out, mental health conditions have increased exponentially during the pandemic. The World Health Organization estimates that amongst children and adolescents, mental health conditions have doubled, and there's still a shortage of mental health services and support mechanisms out there to be able to support children, learners, and their families. One of the things that we do see over the course, we have seen over the course of the pandemic, is the importance that schools play in not only promoting and supporting mental health, but also creating spaces that can support children's learning. Now, when schools close during periods of crisis or emergencies like the pandemic, many children lose all of their mental health supports. So too do families. And we know that there is a link between positive mental health and academic achievement. My colleague Catherine has done a lot of work in this space, but also that schools have a really important role to play in supporting communities too. Schools also can be a place that create mental health concerns and conditions where bullying and violence can occur, and this is particularly apparent and has been apparent over the course of the pandemic also. But when we think about schools as offering support for many people who don't have mental health services, we think about the need for better mental health support also. Learners, educators, and caregivers all need mental health support, and this was something that was apparent long before the pandemic, but the pandemic unfortunately has accelerated mental health conditions and also led to shortages and scarcity of service provision when it comes to mental health support. So it's really important that we look at new ways for supporting the mental health and psychosocial needs of children, but also the adults that care for them and support them in the education sector. One of the really encouraging things we've seen over the course of the pandemic is a willingness to try different ways of supporting learning continuity, as well as thinking about mental health support. And here, remote modalities have played a really key role. So remote modalities, put simply, are diverse and different ways of delivering information during periods of crisis or closure, effectively delivered into the home or into settings where education occurs. As you can see in the graphic up here on the screen, remote learning can occur either independently or through teacher-guided feedback loops. Remote learning can occur through low-tech, no-tech, mid-tech, and high-tech modalities. And it really depends on the context that these modalities are being applied into and the area of reach, access to devices, data, and materials. So in terms of the low and no-tech offline modalities, we have things like printed materials, books, radio, TV. With the teacher-guided modalities, we have things like home visits, calls, SMS, WhatsApp being a huge example and commonly used to support learning continuity during the pandemic. Then we have higher tech modalities like audiobooks, ebooks, phone applications, smartphone apps, online platforms, social messaging, video conferencing, and digital classrooms. And almost every country in the world has experienced some form of remote learning, whether it's no tech up to very high tech. And remote modalities have been very successful in ensuring continuity of learning, increasing access to learning, and mitigating some of the impacts of learning loss and learning concerns that have occurred. There really is very little research, however, on the role that remote modalities can play in supporting mental health. And despite the fact that many modalities are being used during crisis situations and in education and emergency contexts, we still don't know a lot about what works and for who. So the purpose of our research for UNICEF was really to understand the potential that remote modalities have in supporting learners' access to mental health and psychosocial support. We also included examination of socio-emotional learning programs in our review as well, really to see what's being done and what the evidence base is. Very briefly, in terms of our research, we looked at investigating 3 key questions. So the first, we looked at the evidence base on the use, advantages, and challenges associated with remote modalities. And we looked not only at mental health and psychosocial support for learners, but also for caregivers and educators working in the education sector. We also looked at promising interventions that can support MHPSS needs of learners and also provide alternate blended mechanisms when face-to-face learning and mental health support is not possible. Finally, we examined the key considerations for policymakers and practitioners who are looking to introduce or implement mental health and psychosocial supports into their own contexts. And we undertook this research by looking broadly at the academic literature, looking at evidence of effectiveness. We also looked at a wide range of grey literature, policy statements, implementation examples from non-government organisations, donors, partners across different contexts. And we also conducted interviews with key stakeholders involved in implementing mental health supports using remote modalities. It's really important to acknowledge that there's not a lot of research around the use of remote modalities for mental health in low-income contexts and even less in education and emergency contexts, which makes it very, very difficult to ascertain what works. And this is not to say that there aren't many good programs that are working very well in different contexts at the moment. It's just that the developments in this space aren't being kept up with evaluations and trials around the effectiveness of the programs. So we did have a look very, very broadly in the research, but we also looked not only at low-income contexts and emergency contexts, but comparative examples of marginalised populations or disadvantaged groups in higher income countries. In Australia, where I live, for example, we have Indigenous populations who live in very, very difficult situations, and some of the programs that are used in these spaces can be comparable to some of the challenges you see in low-income contexts. Now, in terms of supporting mental health and psychosocial support with remote modalities, we looked at lots of different modalities that are being used for mental health support. We looked at things like radio, broadcasting, TV, digital, online, and we found that there are a wide range being used, but not all have any evidence of effectiveness. What we did determine from our research is that there are many benefits to come from using remote modalities for mental health and psychosocial support. So some of the benefits in particular include increased access, particularly when schools and other education settings are closed. They can be broad-reaching for a diversity of learners. So some remote modalities, for example, games, can be really effective for children with disabilities, children with autism in particular, and children who may not feel comfortable engaging in face-to-face support and supervision also. The other benefits, of course, is that they can be integrated into existing learning practice. And although there's not a lot of evidence of this at the moment, I know today we'll hear from a colleague at Sesame Workshop. There are some excellent examples of ways that mental health and psychosocial support via remote modalities such as games, TV, digital platforms are being integrated in terms of alignment to things like teacher standards and to curricula. Unfortunately, there's also some challenges associated with the use of remote modalities for mental health and psychosocial wellbeing. Probably the largest challenge, just as we've seen over the course of the pandemic, is about access. And as Bassem mentioned, coming off the back of the Transforming Education Summit last week in New York, equity of access was a really common theme when it comes to learning, and it's certainly a common challenge when it comes to the successful use of remote modalities for mental health and wellbeing support. This isn't only about the digital divide, it's also access to data, and it's also around prioritization of who gets the devices, who gets access and who doesn't. So we know that there's a disparity, for example, between boys and girls being able to access devices in the home. And this is certainly an enormous challenge when it comes to some of the higher tech modalities. There are also challenges around child safety. And our research found that the more time that children spend online, the more vulnerable they can be if there isn't effective monitoring in place in the home. There can also be vulnerability in terms of relationships with teachers. And so we'll talk more about this later in the session about accountability and support for teachers as well. Probably, again, like I said, the biggest challenge that we see is around access, and it's about use of different modalities. And we've seen this during the pandemic, that not all teachers have the same levels of digital literacy. And this extends also into the home when parents and children are somehow quickly moving to the use of modalities for learning and mental health support. As I mentioned before, there is very little research from low and middle income contexts on the use of remote modalities, and even less in education and emergency settings. Fortunately, there's been a lot of work in this space, and if there's one positive thing to come out of the pandemic, it is the increased attention on the importance of protecting children's mental health and the mental health of educators and parents also. So the research findings that we present are based, again, on a very small sample of research from education and emergency contexts and low and middle income contexts. But we're very hopeful that in the coming year, there'll be more evidence of effectiveness from these contexts. Again, all of the findings that I will present in a moment consider these contexts in mind to make sure that it is useful and applicable for anyone seeking to implement mental health support. So in lieu of looking at academic research, current implementation examples, all of the helpful suggestions provided by stakeholders involved in actual implementation, we've come up with a little bit of a checklist of what makes an effective MHPSS intervention delivered remotely. The first is that it needs to be evidence-based in order to work. There's not a lot of evidence. I know that I've said this before, and evidence can mean different things to different people. So when we're talking about an evidence base, we're talking about evidence of effectiveness through a trial, through a pilot, through an evaluation, not just through looking at frameworks and concepts. So it's really important that an effective MHPSS intervention delivered remotely is based on evidence that it works. It's really important that interventions are accessible. And so put simply, accessibility relates to cost and to reach. All of the interventions and examples that we present as promising in the report are free and easy to access. There are also included lower cost examples in an innovations list in the report that are also looking to be accessible in the future. But again, there are some very good free programs out there that can be adapted for context. The best and most effective mental health interventions include training and support for educators and caregivers. So they're not just focused on learners, but they're focused on the whole network of support for children and adolescents in the education sector. Targeted support tends to be more effective. And so when we talk about targeted support, we're talking about programs and practices that specifically aim to address one component of mental health and psychosocial support. That might be a social emotional learning intervention. It might be an intervention aimed to reduce anxiety or depression, but the more targeted the intervention, the better the outcomes. Co-designed programs and practices tend to be far more effective. And again, we saw this at the United Nations last week, the importance of having young people as partners in the design and delivery of programs and policies, co-designed interventions that are based on the experiences of those with mental health conditions. They can be much more interactive and interesting, especially for younger people, and particularly where you have educators and caregivers involved, the needs of a broader group can be met. Effective use of technology is the other characteristic that we identified in terms of these examples of promising practices. So effective use of technology, considering what's possible in the context of implementation. So even though we sometimes see programs where devices and data are given out, if there isn't digital literacy there, these programs may not work. So we're seeing a lot of face-to-face programs being adapted to be delivered remotely via radio broadcasting, via TV, via print-based packs, but thinking about how to effectively use technology in a way that works for the context it's delivered in is really important. And again, these characteristics are common across interventions, programs, and practices that use some type of remote delivery to improve mental health in the education sector. There are also some other considerations when it comes to promising interventions for mental health that are delivered using remote modalities. So mental health interventions must support and respond to the wellbeing and mental health needs of learners, educators, and caregivers. We need to not only look at learners as really important in terms of supporting their mental health, but in order to reduce stigma and promote an actual embrace of talking about mental health before it becomes serious and problematic, we need to involve others in the community as well. There needs to be a safe and positive environment for learners and adult participants and other stakeholders. So not only psychological safety, but physical safety also. Mental health programs delivered remotely should also improve the relationships between participants and program delivery staff. So having those involved in implementation and long-term education reform in the community being part of the implementation progress is really important. One of the things that's really important for young learners in particular are appealing and engaging activities. And we're seeing some really great examples of games, for example, and applications that can be a little bit more interesting and appealing for younger learners and make talking about social emotional learning and, again, preventative mental health fun and engaging. And really importantly, mental health interventions delivered remotely, they need to be inclusive, culturally responsive, appropriate for learners of different ages, abilities, and genders. And as we look more broadly at equitable learning practices, we're seeing many of these modalities have different elaborations and adaptations for children with different interests, but also children of different ages and different ability levels, which is really encouraging. And there's also increasing consideration of the role of gender, sexuality, and religion in some of these as well. One of the things we didn't see a lot in the research is a reflection of mental health interventions that can support displaced children and displaced families. And so that's something that still needs to be addressed in research in the future. So from our research looking at characteristics of effective interventions, we did a review of some of the currently implemented mental health and psycho support programs being delivered with remote modalities of some kind. And we came up with a little list of some examples that meet the criteria, particularly around evidence-based and free and accessible. Now, this list is not exhaustive, but these are just some examples of things that are happening in the space. There are also examples of innovations, particularly in the area of things like chatbots, which we'll hear more about today, and teacher-focused mental health interventions also. So you can see from this list I'm just putting up here on the screen, here are some examples of the ways in which programs are being delivered. You can see diversity here of paper-based, radio, phone, online, combinations sometimes. And this list is not exhaustive. These are just some examples. So for any of you looking to implement mental health solutions in your own context, these are some really useful places to begin. And some of these are fantastic for parents as well. I know that the cell kernels in particular and the Sesame Workshop, for example, we'll hear about today, have been really helpful for me as a parent in terms of supporting the mental health of my children. And we'll hear more, as I said, about Sesame Workshop's work in the session later on. Probably our key finding is that remote modalities, they work in different contexts. And if there are the right things considered in terms of implementation, they can be very effectively adapted to support mental health as part of learning. So it doesn't need to be an extra thing for educators and parents to do, but it can become a part of learning practice. And with the diversity of remote modalities, there are some really fun, interesting things that children, parents, and educators can work on together as part of learning. And particularly when it comes to social-emotional learning skills, psychosocial support, connections with others, gender equity, addressing climate change and climate anxiety, there are some really innovative things occurring. And encouragingly, they're reflecting some of the interests of those that work in the education space. So we're really optimistic about the role that remote modalities can play. In terms of implementation, after talking to stakeholders and looking at the research, we've developed a list of recommendations for implementing mental health and psychosocial supports using remote modalities, which I will share with you. And you'll find more information about these recommendations in the report. So for policymakers, and again, this is relevant not only for those of you working in education emergency contexts, but also those of you who are interested in implementing different ways of mental health and psychosocial support in your schools or education sectors. Mainstreaming remote delivery services is really important, and actually thinking about ways to integrate MHPSS. So mental health and psychosocial support is sometimes looked at as a little bit of an add-on, and it can be integrated, and it should be integrated. And we look at more and more policies and practices focused on inclusion. Mental health and wellbeing can certainly be integrated here also. Digital literacy is really important, and we saw research coming out of the OECD last year about the low levels of digital literacy of educators, caregivers, and learners. So it's not only about providing devices and data, but it's also about improving digital literacy through professional development, resources, and training across these different groups. Improving professional capacity and competence and confidence to use remote modalities. Again, when we think about the remote learning research that was done prior to this study, a lot of teachers and educators reported being concerned or a little bit scared about using remote modalities. So a lot of this is just about improving that level of confidence so that there's the willingness to experiment and to try some of these new techniques. Adapting and contextualizing interventions. So again, we've highlighted some examples of promising practices in our report, but this is not every example out there, and context is so important. Making sure that all of the programs and practices and even our checklist is adapted for context is crucial when it comes to effectively implementing MHPSS interventions, particularly with remote modalities. Innovative and engaging solutions are really moving quickly over the course of the pandemic. And particularly with younger children and adolescents who prefer to participate online or in games. We're seeing some really great work. So just because many of these programs are not evaluated as yet doesn't mean that they're not promising, doesn't mean that they're not innovative. But again, there's some really cool stuff coming out that's been co-designed by young people or by people who have lived experience of mental health conditions. Investing in evidence generation and knowledge sharing. Again, we don't have a huge amount of research out of low income and emergency contexts. So being able to prioritize some more collection of evidence about what works and for who is incredibly important. Educator wellbeing is crucial. We looked at many different programs and practices, and we found one that prioritized educator wellbeing, and that's one program that is in Australia at the moment. We know educator wellbeing is affected over the course of the pandemic. We know that burnout and attrition is incredibly high across many contexts. So prioritizing educator wellbeing and treating the wellbeing and mental health of educators as equally important to learners is another recommendation that we make when it comes to thinking about the implementation of MHPSS solutions using remote mechanisms. Protecting learners from violence, making sure that children's safety is a priority is also crucial, and integrating training support for caregivers and parents is also incredibly important in terms of making remote modalities work in the field of mental health in education. For educators, and this includes school leaders, teachers, and any education staff, self-care is critical. So self-care is really looking after yourself, making time to practice positive mental health and keeping an eye on your mental health before you do burn out. And we include some examples of self-care interventions in the report that can be useful in terms of a spectrum of mental health, from the preventative up to supportive, that are delivered well with a clinician. Enhancing capacity to deliver mental health support remotely is really important. And again, this comes back to digital literacy and the willingness to try new things. There's some great stuff out there if you give it a chance. Supporting the development of policies and procedures that integrate mental health into learner activities. We saw some resistance and some concern from teachers and different stakeholders that participated in this study, who said, you know, fair enough, it's really, really difficult. We've got to focus on learning loss, continuity of learning. Mental health's not our problem. We're not psychologists. So it's less about diagnosing and treating the children that you work with, and more about being aware of the policies and procedures. And that includes referral processes and knowing when to ask for help and support from others. Staying connected to others, again, around promoting your own mental health as educators is really important. Staying connected, being part of the community, it can help reduce stigma and also build that social capital and social connectedness. Using remote modalities to continue supporting social and emotional learning. We know that social and emotional learning is a priority for UNICEF, and there are some fantastic programs around. We didn't look at face-to-face programs. It was out of the scope for this study, but there are many programs currently being adapted, and remote modalities can help children to be able to talk about their feelings, be able to learn self-regulation and coping strategies, and talk to their families about this as well. And again, particularly in the digital online TV space, there's some really fun activities out there that can support and promote social emotional learning. Trying different modes and modalities. I know it's not always easy. I used to be a teacher as well. Sometimes you don't have time, but thinking about ways to integrate some of these modalities into practice. And not only when schools are closed, but thinking about how we do that moving forward, which I'll talk more about in a moment. Engaging parents and caregivers is also a really crucial recommendation for effective implementation of mental health support. We know families are quite engaged now because of the pandemic, and many of us have had to spend time at home with children, and we're more interested and aware, and there's also increased awareness globally about mental health conditions amongst children. So being able to engage parents and caregivers and making this a partnership and not something you have to take on yourself, we have a really great opportunity at this moment in time. And of course, referral pathways, knowing when to refer and when you can intervene is really important. Teachers are not psychologists. We're not always trained in this space. So being aware of referral pathways and asking for help when needed. Some additional considerations for those of you working in education in emergency contexts is always about prioritising those learners affected by emergencies, being prepared rather than reactive. Again, you know, my fear is that with remote modalities that will throw a lot of it out when the pandemic ends, and we've had such innovation and development in this space. It'd be useful to think about how we could take some of these lessons and look at some of these innovations and keep using them in the future, including mental health and psychosocial support in terms of needs assessments, making sure that mental health and psychosocial support is prioritised and considered as important as academic learning. And we're seeing more conversation around this, which is really encouraging. Supporting educators, because sometimes educators, particularly those working in emergency contexts, don't have a huge amount of support, but also fostering accountability. We certainly saw in our research some concerns around a lack of accountability for educators who may have one-on-one contact with students or may place students in positions of vulnerability. So, of course, we need more support for educators, but we also need to make sure that there's accountability processes in place during periods of crisis and displacement. And thinking about the role that remote modalities can play in terms of maximising reach and relevance. And so when it does come to designing, adapting or implementing programs, really looking at these checklists around evidence, accessibility and what works for the context in the long term, and also sharing some of the evidence with others in the space. Probably my key point before I hand over to the other panelists to discuss some of the innovations and interventions around remote modalities for mental health is that we need to think much more creatively about how to integrate mental health and psychosocial support into education. We looked at a number of interventions and unfortunately very few are aligned to current educational practice. And if we have them treated as distinct or separate activities, we'll get much less buy-in and take-up from educators at a school level. So we have to think a little bit more creatively about how we integrate mental health. And again, remote modalities can provide interesting, engaging solutions that can be used broadly. And they can work during periods of crisis and beyond. So even though we call them remote modalities, as we move forward and we think about new ways of schooling, new ways of learning, thinking about remote modalities as becoming a core part of blended pedagogy and thinking about how remote modalities can help children, educators, and caregivers, not only during the COVID pandemic or during other periods of crisis, but how this can become a normal, interesting part of everyday educational practice is a key consideration. We're really optimistic that remote modalities hold much promise and potential. And again, we should look at ways to improve their integration moving forward, gather more evidence, and make mental health and psychosocial support a core part of educational practice. All right, Rachel, I'll hand back to you. Thank you so much. And again, my details are up here if anyone has any questions after the session, and the full report has been launched today. And congratulations to UNICEF on this report. We will also be sharing this in the chat during the session. But Rachel, I'll hand back over to you.
Thank you so much, Anna, and congratulations to you and your team for this brilliant piece of research. And Sarah's just shared the link there in the chat. I'll hand over now to Fatima Abdelwahed. Fatima is the education manager in the International Social Impact Department at Sesame Workshop. She supports program design, curriculum development, the creation of child and adult-facing print and multimedia content, and the production of local versions of Sesame Street, known as Ahlan Zamzam, across Africa and the Middle East. She supports the production and the creation of teaching and learning materials for outreach programs. So handing over to you now, Fatima.
Thank you so much, Rachel. Thank you, INAEE, UNICEF, and Dr. Dabrowski for the insightful presentation. Today, I will share a bit about Ahlan Simsim and our delivery of MHPSS. So Ahlan Simsim is a TV show targeting children 3 to 8 years old. It's part of a larger humanitarian program that addresses the impacts of crisis and displacement through the delivery of early learning and nurturing care to children and caregivers impacted by the Syrian crisis. This is done through TV and direct services in health centers, ECD centers, or other spaces. The show itself was meant to reach children in Iraq, Jordan, Lebanon, and Syria, but given the TV component in it, actually reaches children all across the Middle East and North Africa, and actually, as of recently, have reached over 23 million children. So we do have that direct services component, but today I'll focus mainly on the TV part. So at the start of the program, the plan was to create a curriculum that focused on resilience. As part of the Sesame Workshop workshop process, a local curriculum seminar was held to get input and guidance from local advisors, ECT specialists, therapists on, creating a show that focused on resilience. During that seminar, we heard from them that we need to step back. Before diving into resilience, we need to think about building blocks of the emotional building blocks and emotional ABCs. So we took a step back and decided to really focus on emotions, emotional identification and regulation. And so that's what you see for season 1 and 2. But before jumping into that, we actually conducted a baseline study and confirmed what our advisors had mentioned. That children in the region were using 2 to 3 words to describe their emotions, and that caregivers also needed additional support. And so that, gave us a further push to really focus on seasons 1 and 2 on exposing children to different emotional vocabulary, strategies they could use to manage their emotions. And so following that, we focused season 3 on perspective taking, building up on that, using strategies like stop, notice, think. If someone around me is having what we call a big feeling, I need to stop and pause for myself, take that belly breath, count to 5. I need to notice what that person's feeling, and I need to think about how I can support them in that process. So thinking about someone else's perspective in that. This, of course, builds on that emotional regulation, and it naturally builds on season 1 and 2. Following that, season 4, we have a focus on optimism and hope. This is really encouraging children to use positive self-talk, positive affirmations, a power pose. So posing in a stance that makes you feel confident, that makes you feel comfortable and ready to tackle whatever it is you're having a challenge with. The power of yet. So I may not be able to ride a bike yet, but I will in the future, or I may not be able to read yet, but I will in the future. And then thinking of a role model, channeling someone that you look up to and inspires you, and thinking about, well, what would they do in this situation, to push through, to move forward. In season 5, the creation of this season was heavily inspired by the altruistic culture of the region, the Middle East, which is great, but can also be a double-edged sword in a way. While it's important to show kindness and care for others, it's equally important to think about your needs and show yourself that same kindness that you would extend to others. So this was a really important part of developing this season's curriculum. So the idea is to either show yourself kindness through self-compassion, self-forgiveness, or speaking positively to oneself to boost self-esteem. For example, I'm just not understanding today. I'm just not able to recall what the names of these animals are, but I know that I'm really good at making animal sounds. So going back, thinking about what you can contribute, how you can be kind to yourself, how you can speak positively to yourself. And then the other is showing kindness to others. And so what that looks like is giving someone space when they're experiencing a big feeling, forgiving them, and providing encouragement if someone is not feeling, so happy today, feeling a little sad, feeling upset about a situation, understanding how you can support others. And the last season is imagination, and this focuses on either role-playing, imagining alternative solutions, or imagining yourself in someone else's shoes to solve a problem. So what you don't see here is that all of these seasons, though they stand alone and in a way built on each other, is that we take each one of these as a season of its own, very separately, and always keep in mind that we're going to have a new cohort of children watching this show. We're going to have a new group of kids watching each episode. And so the idea when we go through each of these seasons is that we break down each one of these aspects and present it every single time as if it was the first time a child was receiving that information. And though co-viewing, and that's the process of a child viewing the show with an adult, though co-viewing is great, we always keep in mind that a child may not view sessions with their parents, with an adult, to break down the instructions for them or break down what's happening for them in terms of emotions, in terms of how our characters are feeling. And so we have a couple of characters in the show that actually provide that breakdown and help children process and understand a bit more about their emotions. They look like bugs is what we've heard time and time again, but they're Dubka dancers, the bug-looking characters on the screen that you see right here. They support that process and breaking down, what a character may be feeling. So you may see a character that's feeling really sad, and we'll jump to the Dubka dancers to unpack that a little bit. Like, Basma looks a little sad today. I see that she's frowning and her head's held low a little bit. I wonder what's going on. And then we'll jump into that and unpack it a little more. We can go to the next slide. So what you'll see coming up here next is a clip with everything that I've shared in action. You'll see our characters. Basma is the one in purple, Jad behind her in yellow. They are our two main characters. They experience different feelings. And then we have Hadi and Teta Noor, our human characters. I'll let you watch and then I'll jump into a little bit about their role in this.
بسمة إيش مالك؟
هادي أنا خايفة مش عارفة شو أعمل.
طيب بسمة كلنا بنخاف، كل الناس بتخاف. طبعا حتى أنا بخاف.
حتى أنت؟
أكيد، في مليون شغلة بخاف منها. بس تعرف شو بعمل لما بخاف؟
إيش بتعمل لما تخاف؟
خليكي هون.
لما يكون شعورك قوي ومش عارف شو بيك، عندي طريقة بتهديك، خلي عبطنك ايدك، خد نفس عميق، خد شهيق، خد نفس عميق، خد شهيق زفير، شهيق زفير، شهيق زفير، شهيق زفير.
حاسة حالي أحسن شوي.
صح؟
شكراً.
Okay, so in terms of that, we can actually go back. In terms of that video clip, you'll notice that we have a mix of Muppets and humans. So in the clip that you watched, we have Hadi and Teta Noor, as I mentioned, and there are two human characters in the show. And recently we've also added in Selma. Our human characters are there to validate the Muppets' feelings, validate Basma's feelings, Hadi's feelings, Jad's feelings, any of the feelings that they experience. They're there to provide support to them when they aren't sure what to do. So in early seasons, if a character, for example, was experiencing a big feeling like Basma feeling afraid, it's there, they were offering her that, coping strategy to use. And so, okay, so noted, Rachel, on the time. So they're there to offer that additional support, and they're also there to serve as role models on how adults can support children in managing and regulating their emotions and overcoming challenges. I just want to share, I mentioned at the start that we included advisors at the curriculum development stage, but I just want to point out that throughout the whole period, there's advisors that are included, not just during that curriculum stage, but as we're working on scripts, as we're creating the songs, and even to give input on the set itself to make sure that it's contextually and culturally relevant and of course age appropriate. Next slide, please. So I won't delve in to these just given the time constraints right now, but overall what we're seeing is that parents are reporting that the show has taught their children new vocabulary, new emotions and vocabulary words, and that for parents, it's also taught them some new words. And this is great given that at baseline, season 1, we were noticing that children had a span of 2 to 3 words. Kids are applying lessons learned in the show to their interactions with friends and family. I mean, this is great because it's one thing to see the show, but when we see that children are actually putting the lessons into action, you know, it really shows you that they've started to internalize these messages. Kids learn to be kind to themselves and others. This was from season 5, in which that was the focus, that we're seeing that children are extending that kindness to themselves. And then parents are finding that the lessons and strategies are beneficial for them and their children. And so it's great, you know, again, when we see that parents are also taking these lessons away, because that can help bolster what children are getting from the show and expanding that learning and internalizing that learning. Next slide. So I just want to wrap up by saying thank you so much. And while this is just that one component, I want to echo Dr. Dabrowski's comments in that it's essential to provide that support to caregivers, to teachers as well. And so that's also a component of the program. But today the focus was just on that TV piece. Thank you so much, and over to you, Rachel.
Shukran, ya Fatima, and I'm so sorry to rush you through that presentation. I love hearing about Ahlan Simsim, and those research findings are fascinating, especially seeing the quotes from parents and students. So over to our final presenter for today. I'd like to welcome Victor Olusoji Ladele, who is the Innovation Lead at UNICEF's Office of Global Innovation, working to nurture and support mental health and psychosocial wellbeing innovation portfolio. Previously, he helped to establish, as the head of exploration, UNDP's award-winning innovation accelerator labs at the Pacific office in Fiji. And before that, served in multiple humanitarian field coordination roles with WHO Health Emergencies and with UN Peacekeeping in Sudan, Liberia, and others as a medical officer and health coordinator. So over to you now, Victor. Thank you.
Thank you very much. Can you hear me?
Yes, yeah,
And see.
loud and clear.
Okay.
And see.
I miss the days of face-to-face meetings. Well, there are many definitions of innovation, but one of the ones I like best is the one that says innovation is a mixture of the old and the new with a dash of surprise. And who knew that in a seminar to launch a report on education, I was going to be transported back to my childhood and watch Sesame Street clips, which really taught me so much. I'm going to spend the next, first of all, I'd like to thank INEE, UNICEF Education, sesame.org, the host and all the participants on here. Thanks for having me and giving me this opportunity to spend the next few minutes to share some of the perspectives from the mental health innovation work of UNICEF, some of the solutions in our portfolio, and some of the promising clusters of innovation for the future of mental health. And most importantly, the process of innovation as a means to turn ideas, your ideas, to solutions, to work around challenges and to generate evidence where none exists. I'm pretty sure we're all familiar with the size of the mental health challenge, how it's a leading cause of death for young people. It's a leading cause of the global disease burden, and how most of the mental health conditions that arise in early ages become very chronic with lifelong implications. But what is also clear is that mental health is also a problem with massive implications for economic growth and productivity. And also, mental health is a personal problem felt everywhere, and issues of mental health touch everyone. Emerging evidence indicates that the prevalence of mental ill health is growing. Climate change, environmental degradation, urbanization, technological leaps, these all have profound impacts on the minds of young people and children. And we still know very little about these things, how to manage them, and also how to harness these changes to improve the mental health of children. And why are new solutions and innovations needed right now? It's because mental health is an increasing priority for most governments, but that commitment has yet to translate to resources. So we try to use innovation to maximize the resources available to us. Furthermore, young people themselves are making their voices heard on mental health issues. With the increasing agency they have through the platforms they have, they are demanding action on mental health. But also, like Dr. Dabrowski mentioned and alluded to, new opportunities to address this need are emerging. COVID-19 was an accelerator of many changes, among which are the use of telehealth for medicine, for healthcare, but also for mental health. Then also the practices of systems innovation and social innovation are becoming mature, and they are helping us to deal with complexity, make that first move when no evidence exists, to solve problems and to generate evidence that leads to more research and more action. UNICEF is at the forefront of these changes through our commitment to take action, protect, and care for the mental health of the next generation through a committed action plan with clear priorities and pillars. For the last 75 years, we've been working for the well-being of children with presence in 190 countries and growing. And the role of the Office of Innovation really is to help discover, co-create, and scale bold solutions and technologies to deliver for children today and to set a new pace of social impact for coming generations. Last year, we focused on putting children and young people at the heart of the global mental debate through the State of the World Children's Report, which focused on mental health, and then investing into a mental health innovation portfolio, which I will share some of the solutions in it with you in the next few slides. And for generally acting as a catalyst for exploiting the power of new technologies and new ways of generating solutions to fill the knowledge gaps in mental health. Our current innovation portfolio has digital and non-digital innovations, and we know from what we have learned over the past 1 year that the future of mental health will look very different from the past as public interest grows and technology underpinning many of the innovations evolves with increasing awareness of both their benefits and potential for harm. The next few slides, I'll share some of the solutions in our portfolio. One is telehealth, and it's helping to address in many settings, not only access to mental health services, but also training of workforces. Before somewhat the crisis in Ukraine slowed down some of our efforts, we were developing solutions that extract open data from social media and other sources to spot trends and prevent self-harm, and feed this data back to people who are planning programs to intervene for children and young people. In Guatemala at the moment, we're investing in a video game that is helping to increase access to care by previously unreached populations. And it's also helping us to understand more about the role that video games have to play in promoting mental health. One of our very promising solutions at the moment is chatbots. It's in the early days yet because the ambition is to have conversational AI that can make chatbots more effective, but we'll start from where we are, which is an automated chatbot that helps to deliver mental health content, and users, after a period of triage, have the option to talk to a human coach. Another solution that is very exciting and promising in the Eastern European region is You Support Me, which is a web and app-based platform that will connect excess demand in some parts of the country where mental health expertise is concentrated to demand in parts of the country where you don't have that many experts, so thereby bridging the gap in access to services. Looking more future-facing, we're also exploring clusters of innovation that we know are going to be a significant part of our future, but to which much evidence does not yet exist. What role will virtual reality play in mental health, in not only training, but also access to care? These are the things that we're looking at. We're also exploring to solve the problem of paucity and lack of useful data and feedback in the mental health space, how to leverage smartphones and wearables to create more representative data pools. Then also, of course, predictive analytics to guide mental health policy and programming. But what's really interesting is that innovation happens at the intersection of disciplines, and this is something that should be embraced and not shunned. Our innovation process is a structured approach to creative problem solving that embraces divergent and unconventional thinking. It doesn't start with solutions first or the technology, but how do we make sense of the increasing complexity in our world? Mental health and solutions to mental health at scale is a complex problem, but the world is also becoming increasingly complex. How do we create a better breed of solutions that can not only meet the need, but also accelerate and scale to as many people that need them, not only in high income settings, but also low income settings? And we've developed and we're refining processes for managing and scaling portfolios of innovations from pilot to scale. And how we define scale is multiple countries and multiple millions. And the innovation process is more or less a continuous trajectory of scanning, looking at what the new developments are, and finding ways to translate that research, that intelligence into design sprints. These design sprints are structured in a way to help us quickly learn about a problem space, the stakeholders, the actors, and where the leverage points for action. And we're working alongside our colleagues in education and other units to bring about a future where young people everywhere have the mental health tools and support they need to thrive and prosper free of stigma, including in education settings. Thank you very much, and I'll stop here.
Thank you so much, Victor. I feel like we could have probably a whole session just looking at some of these innovations that you took us through. Definitely need some more time to dig into those. So thank you so much for sharing that. I just dropped in the chat the link to the UNICEF innovation page as well, if people want to have a look through. So we've actually come to the end of our webinar. We've run out of time for our Q&A, unfortunately. There were a couple of questions in the chat, and what we will do is just forward those to our speakers who can then answer them, and we can share those answers when we send out the recording following up from this webinar. So just to say a huge thank you to everybody for taking the time to join us today, and a huge thanks to our panelists for your fantastic presentations and for this new report that we're all really excited to read. So take good care, and for those of you in Australia, it's time for you to go to bed, I think.
Thank you.
Thank you so much. Thank you, Fatima. Thank you, Catherine.
Thank you. Wonderful.
Thanks, Victor. Thanks, Kashfi.